Welcome back to our channel. Today we're diving into a topic close to the hearts of many women, fertility, and how a medication called letrozole can help. So, whether you're trying to conceive or just curious about fertility treatments, this video is for you. Letrozole is a medication primarily used for treating infertility in women. It belongs to a class of drugs known as aromatase inhibitors. Now, let me break that down for you. In our bodies, an enzyme called aromatase is responsible for converting androgens, male hormones, into estrogen, female hormones. When there's an overproduction of estrogen, it can negatively impact ovulation, making it challenging to conceive. But fear not, ladies. Letrozole comes to the rescue. It works by inhibiting the aromatase enzyme, which reduces estrogen levels and promotes healthy ovulation. And the best part? It's available in tablet form, making it easy to take. Now let's talk about how letrozole is used and dosed for fertility. Typically, letrozole is prescribed to be taken once a day for 5 days, usually starting on the second or third day of your menstrual cycle. This helps stimulate the ovaries to release eggs and improves the chances of pregnancy. But remember, ladies, it's crucial to follow your doctor's instructions regarding the dosage and timing for the best results. Now, like any medication, letrozole has some potential side effects. Don't worry, we've got your back. The most common side effects include hot flashes, headaches, and mild nausea. But keep in mind that not all women experience these side effects, and they're usually temporary. Ladies, as much as we want to help you, it's essential to be aware of the contraindications. If you have a history of liver disease or allergic reactions to any medications, make sure to inform your doctor. Letrozole may not be suitable for you in such cases. We care about your well-being, so let's discuss some precautions. While using letrozole, it's essential to keep your doctor informed about any other medications or supplements you're taking. Some drugs may interact with letrozole and affect its effectiveness. All right, let's get a bit technical. Understanding the mechanism of action, MOA, and half-life can help you grasp the medication's effectiveness better. As we mentioned earlier, letrozole inhibits the aromatase enzyme, which decreases estrogen levels. This in turn promotes regular ovulation and increases the chances of getting pregnant. The half-life of letrozole is about 2 days. That means it takes about 2 days for half of the medication to leave your system. So there you have it, ladies, the wonderful world of letrozole and how it can boost fertility. Remember, if you're trying to conceive and facing challenges, don't hesitate to talk to your doctor about the possibility of using letrozole. Thank you all for joining us today. If you found this video helpful, give it a thumbs up, and don't forget to subscribe to our channel for more informative content like this. Bye for now, and remember, ladies, you've got this. Stay positive and take care of yourselves. We'll see you in the next video. Bye.